Good afternoon, everyone. Excuse me for my water. I'm just recovering from a little cough, so if I if I need to, I will leave the lid off and everything. So, good afternoon, everyone. Thank you so much for having me along today to talk about the magic of exercise, because it really is magical. So, now I need to work out what I'm doing here. There we go. So, what we're going to be talking about today is how powerful exercise can be in terms of managing your health, your well-being and your recovery, both during and potentially after breast cancer treatment as well. So, first I ask you, what's so good about exercise? Does anyone have any personal little experiences from exercise that they would like to share about what they think is good about exercise? We're all going to be shy. Keeps you strong. It's my mother-in-law, so planted her. Yay! Think clearly, yes, yep. Bit of mental clarity.
Do something with mates.
Yes, yep. The social side of it as well. So lots of really good things about exercise. But for me to sort of really answer this question today and to be able to pull it in from that research perspective. So as an exercise physiologist, we are very evidence-based. The advice that we provide to people is based on the evidence that exists and our experiences and all of those sorts of things as well. So to answer this, we're just going to go back a couple of steps. So generally involved in our treatment journey is surgery. So along with surgery comes the risk of, we've got to heal from the surgery. You might have a bit of a reduced range of motion through your arm and things like that. And often we use exercises to help get you moving again. There is that increased risk of lymphedema. So I've just heard from Orla, exercise plays a really important role in reducing the risk of getting lymphedema, but also managing lymphedema should that happen as well. So that's the first thing. Next on the list we have chemotherapy. So one of the really big side effects from chemotherapy, aside from the hair loss and the nausea and the generally feeling like rubbish, are things like fatigue. So we know that, you're going to be really, really tired if you're having chemo. And I'm the same as Orla. I can't see that screen without my glasses on. I'm going to turn around. So we have reduced muscle mass, so reduced strength, reduced bone density, and these are the things that you might not necessarily notice in your day-to-day. But you might start to notice an overall decrease in your physical function, so the amount of things that you can do. And we also have the side effect of neuropathy, so that's like where you get the tingling or the change of sensation in your feet, your fingers. So that's the sort of major side effects associated with chemotherapy, along with a whole list of others. Next on our treatment list we have radiation. So again, fatigue is a big one associated with our radiation therapy. Also that loss of bone density and muscle mass as well. And you might start to notice that the area that you're having the radiation applied to becomes quite stiff as well. So you might have just been getting your movement back from your surgery, and then it starts to get really stiff again. So that's one of the side effects of radiation. And then last but definitely not least is our hormone therapies. So hormone therapies again have a whole host of side effects, which include things like fatigue, again, loss of muscle mass, so like muscle strength, loss of your bone density as well, sleep disturbances. I think that was all there? Yep, that's all that is there for that one. But again, these are just a very brief snapshot of the side effects, and I'm pretty confident to say if I asked every person in this room to put their hand up that's experienced at least one of those side effects, I think that would be it would be pretty much everyone. So these are the ones that I've sort of chosen to highlight today, because these are the things that a lot of the research lies around in terms of things that exercise can help with. So just to recap those, we had fatigue, that loss of muscle strength, reduced bone density, which greatly impacts our ability to function. So carry the groceries in, stand up out of a chair, get in and out of the car, lift up your kids, your grandkids, all of that sort of stuff. And then we have the sleep quality as well. So this is getting to sleep, staying to sleep, and just that overall sleep quality. And all of these greatly impact our quality of life. And quality of life also not only includes that physical stuff that I've sort of been talking about, but also the mental side of that as well, because there's a really big mental load that comes with managing treatment and all of the side effects that go along with it. So anything that we can do to help improve your quality of life is going to be a good thing. So that brings me back to So what's so good about exercise? And that is that exercise can help to manage all of those side effects that we just talked about. So yes, there's things that exercise can't do, like it's not going to stop your hair falling out, it's not necessarily going to help you feel less sick, but in terms of all of those major things around our physical function and our quality of life, exercise has a big impact on all of those things. So this is what the research tells us. So when it comes to fatigue, and never going to be able to read that. So high intensity interval training during chemotherapy improves strength, quality of life, and reduces cancer-related fatigue. And now there's probably a lot of people in this room that go, high intensity, ooh, that's scary. And I just want to remind you that high intensity is relative. So what's high intensity for me isn't going to be the same as what's high intensity for somebody else. So don't be scared if that sort of gets brought up at some point in time. Don't be scared of that. But I'll get to another study in a sec that is a little less intimidating. So again, when it comes to metastatic cancer, we see that exercise improves, again, quality of life and fatigue associated with the treatments in managing metastatic cancer. Both aerobic and resistance exercise improve fatigue. Exercise during radiation improves fatigue. And this is the one I was referring to before, which is seated exercise. Can help to manage fatigue while undergoing treatment for advanced breast cancer as well. So this is just a really small snapshot of the studies that are out there, but you can see that aerobic exercise, resistance exercise, higher intensities, lower intensities can all help to manage that fatigue associated with treatments, whether it's chemo, radiation, whatever it might be. The next one we have, and I'll just flick through these really quickly because we've got loss of muscle mass. So again, aerobic and resistance exercise will help improve loss of muscle mass during treatment. And I quite like this one. So low dose exercise can actually help to improve muscle loss during chemotherapy. So this study in particular directly compared higher intensities or higher loads of resistance training with lower loads of resistance training. And they actually found the lower doses to be more effective. Why that is, we're not entirely sure. It might be due to the recovery with all the chemo and everything that's going on. But even just, once a week doing some resistance training can have some really, really good benefits in terms of preserving your muscle mass. Again, exercise during radiation improves muscle mass and can help to preserve muscle mass in metastatic cancer as well. So again, just a little snapshot, but there's a good bit of evidence there. And same goes for our bone density. So weight-bearing aerobic exercises and resistance exercise can maintain bone density during chemotherapy, improves post-treatment as well. And a combination of both aerobic and resistance exercise is going to be really beneficial if you're on hormone therapy as well. Sleep quality, I find sleep fascinating, and I know it's a really, really tricky thing for a lot of people, but what we do know is that when you engage in physical activity outside of cancer treatment, it can help to improve our sleep quality, and the same goes for when we are undergoing cancer treatment as well. So it's been shown to improve the ability to get to sleep, to stay asleep, so again that overall sleep quality, and there is a bit of an association with higher volumes of exercise having a bit of a greater effect on improving that sleep quality, but again it's not always as easy as that. It's all well and good to say do some exercise and you'll get some sleep at night. There's a whole lot of other factors that are going along in terms of hormones. When we, just to completely go to the opposite end of the scale, but when we look at babies and toddlers and their sleep cycles, engaging in physical activity and sensory stimulation is really important to build enough sleep pressure to get to sleep. When you're going through cancer treatment, you're not engaging as much physical activity as you normally would. You're not doing as much as your daily chores and things like that as you would. You're not getting the same sensory stimulation. So all of those things are going to impact on your sleep quality as well. So I guess there are some things outside of your control in terms of the hormone factors, But if you can sort of focus on those things that you can control around, getting that physical activity and getting that sensory stimulation, that can be really helpful. So, what are the general recommendations? If we take all of these research papers, which are filled with all sorts of different bits and pieces, what it comes down to are probably these following things. So, a combination of both aerobic and resistance exercise is what is most beneficial. So, if you can find a way to incorporate a little bit of both, that's going to be your best option, really, particularly from the physical function, so the muscle mass and the bone density side of things. That's where that resistance exercise is really, really important. It's also important to note that exercise is safe. It's really, overwhelming, the evidence that says that exercise is safe in people undergoing radiation treatment, cancer, chemotherapy, hormone therapy, and in metastatic cancer as well. So it's really important to understand that what you're doing is going to improve your health. It's certainly not going to place you at any increased risk. And finally and this is a sort of an extra onto that, is that seeking advice from an appropriately qualified exercise professional is highly recommended. So people that have experience working with in the cancer space, because what we do is we tailor your exercise prescription to suit where you're at, what side effects you've got going on, what stage of treatment that you are in, and all of those sorts of things. So seeking advice from someone is really important if you are able to do that. And supervised sessions can be really helpful as well. Not only from making sure that we're keeping you safe and doing all the right sorts of things, but also from a motivation point of view. I know if I have an exercise class that I'm booked in to go to, I'm much more likely to do that than to go, I really should do some exercise, but I might do the dishes instead. I was talking to some of the ladies at the breakfast meeting this morning around the fact that exercise is something that's quite hard to get people to do at the best of times. And here we are asking you to exercise when you're potentially feeling at your worst. And so it's a really hard thing to get your head around. And so that's why we talk about starting small. So take just little bits and pieces. If it's a walk to the letterbox and back, that's a win. And something is always better than nothing. So it's all well and good for me to stand up here and say, you should be doing aerobic exercise and resistance exercise and all of that sort of stuff. And in an ideal world, we would be able to do all of that. But something is always better than nothing. So if you can just do a tiny little bit in your day, that's awesome. And the other thing is focusing on priority areas. And so what I mean by this is focusing on the area that you have the most control over at this point in time, or the area that's bothering you the most. So, for example, I saw a lady the other day, she's on chemotherapy, just coming towards the end of radiation therapy. She is absolutely exhausted, she's done. And she was coming back to me going, oh my goodness, she's gonna give me more exercise, I can't deal with that right now. And so what we talked about instead is focusing on what she can manage at this particular point in time. So because of the radiation, she was starting to get a little bit of loss of mobility and some stiffness through her shoulder. So we just talked about focusing on her range of motion exercise and a little bit of strength exercises for her shoulder to keep her moving. If she's up for a walk, well and good, awesome, go for it. But just focus on what she could manage at that point in time. So yeah, that's what I mean by focusing on those priority areas and just do what you can, essentially. Get support. So support from friends, family is a really good thing. If you've got someone coming around to visit you, try and go out for a walk instead of, sitting and chatting. Walk and chat. Might be a short walk, might be a slow walk, but a walk down the left. And, fresh air is really important too, and particularly fresh at the moment, but you know what I mean. Getting outside and moving is a really good thing. Outside of that, we have our wonderful breast care nurses, Colette and Sandra. They're always a phone call away. We have the Cancer Council, so they have a range of support groups and things like that as well. So there's breast-specific group that meet on a Tuesday, and they have day and evening sessions available. So if you're working, you can go to the evening sessions, so you're not missing out. And we also have the BCNA My Journey app as well. So that's got some really useful information in there, and there's like the peer support networks and things like that are available through BCNA as well. So reach out. I think, as Carrie alluded to before, the support is out there. Sometimes it takes a little bit of digging, but it can be found. So in terms of exercise, these are some of the local options that we offer. So shameless plug, Body Connect Exercise Physiology. So as I sort of mentioned before, we do individualised group exercise classes. So even though it's in a group environment, everyone gets their own exercise prescription based on where they're at, what's going on. And we do have a cancer specific class as well. So everyone in that class has a cancer diagnosis. We have other ones as well. I know PhysioFit, Imbalance and PhysioTaz all run supervised group exercise classes as well. And the Cancer Council run various programs throughout the year, and they're all free too, which is really, really good. So in terms of accessing funding, because obviously there's a fairly decent financial impact that comes with cancer and managing your treatment. You might not be working and all of those sorts of things. So the biggest one would be a team care arrangement. So this is something that you can access through your GP. Anyone who has any form of chronic health condition, and that includes cancer, is entitled to get a team care arrangement, and this entitles them to 5 allied health professional visits per calendar year. 5 is not enough, but it's a start. And so that basically means that you'll be bulk billed, or there might be a small gap fee, for example, but it just reduces the costs of accessing either an exercise physiologist or a physio, or even psychology support can be through a team care arrangement or a mental health care plan as well. Can't quite read that. Private health insurance as well. So private health insurance generally will cover some of the cost of both individual and group exercise classes. So if you have got access to that, then that's going to just help in a little way as well. And as I mentioned before, the Cancer Council services are all free. So they don't run all the time, but they do have quite a number of programs that you can access, and are a really good resource as well. And that's about all that I had to say. So, made it through that.